This video is about mastering adjectives in English. Imagine you walk into a hospital and hear the following two sentences. A patient entered the room. Now listen to this version. An elderly patient with severe chest pain entered the emergency room. Which sentence gives you a clear picture? Obviously, the second one. Do you know the reason why? Because it contains descriptive words that helps us understand the situation more precisely. So these descriptive words are called adjectives. Without adjectives, language becomes flat, vague, and incomplete. Imagine describing a medical condition, a research finding, a legal document, or even a personal experience. Without using descriptive language, it would be almost impossible to communicate accurately, right? So adjectives allows us to add detail, clarity, precision, and emotion to our sentences. In professional communication, whether in healthcare, academic writing, or daily conversation, these adjectives plays a major role. So today we will explore adjectives in depth. So by the end of this lesson, you will understand what adjectives are, why are they important, the different types, the function, and how to use them effectively in real life communication. So, what do you mean by an adjective? It is a word that modifies or describes a noun or pronoun by providing additional information about its qualities, quantity, identity, or characteristics. In simple terms, an adjective answers questions such as what kind, which one, how many, or how much. For example, the experienced surgeon performed a complex procedure. So here, experience describes the surgeon, right? Complex describes the procedure. Adjectives allow us to add precision to our communication. Without adjectives, the sentences becomes the surgeon performed a procedure. Technically correct, but informationally weak, isn't it? So let me tell you the purpose of adjectives. Adjectives serve several important functions in language by providing descriptions, by adding precision, by enhancing professional communication, and so on. So let's see one by one. Adjectives describes qualities or characteristics. For example, the patient showed significant improvement after treatment. Here, the adjective significant clarifies the extent of the improvement, isn't it? And adjectives help distinguish one thing from another, like, to compare. The doctor prescribed a strong antibiotic. So, without the adjective, the doctor prescribed an antibiotic, which is the treatment will be unclear in that sentence, isn't it? And enhancing professional communication. So, especially when it comes to the professional ethics, adjectives help to convey specific information efficiently. Here is an example. The patient reported persistent abdominal pain. So, here the adjective persistent indicates the duration and creating imagery and clarity, which means it helps the listeners or reader visualizes situations more clearly. For example, the laboratory reported elevated glucose levels, which means the adjective elevated immediately indicates the abnormal results, isn't it? So that's the purpose of adjectives. And we do have different types of adjectives, several categories based on their functions. We call them as descriptive adjectives, which describes the qualities or characteristics. For example, the patient experienced severe fatigue. The researcher published an innovative study. The hospital implemented a comprehensive treatment plan. So these adjectives describe conditions, qualities, or attributes. Here, if you see all the examples, it is related to the medical setup because that is what I have taken. So I can just, tell you the examples based on that. So that's the theme for today's lesson. Now, the second one is quantitative adjectives. So these indicate quantity or amount. The clinic treated several patients with similar symptoms. The study examined numerous clinical trials. The laboratory conducted multiple diagnostic tests. Got it? So they answer the question, how many? That's why it is quantitative. And the demonstrative adjectives, possessive adjectives. So these indicate specific nouns when we say demonstrative. Common demonstrative adjectives are like this, that, these, those. So here are some of the examples. This treatment has proven effective. Those symptoms require further investigation. These medications must be taken daily. Can you see the words? Yes. So that's why we call it as demonstrative. And possessive means it indicates the ownership or association. For example, her research focuses on neurological disorders. Their findings were published in a medical journal. Our department specializes in cardiology. So this one shows the possession, right? The belongingness. Common possessive adjectives are my, your, his, her, its, are, their. So these are some of the commonly used possessive adjectives. And the next one is the interrogative adjectives. So they are used in questions basically. So common ones include which, what, whose, all these type of WH words. So which medication caused the reaction? What symptoms did the patient report? Whose report contains the updated diagnosis? Got it? These are some of the examples. And then comparative and superlative adjectives. So this one express the degrees of comparisons. For example, positive degree means the treatment is effective. This means something is positive, right? And when we say comparative, that means comparing with another one. This treatment is more effective than the previous one. So here we are comparing. And superlative, that means which is the best. This is the most effective treatment available. So that one is the superlative degree. And placements of adjectives in sentences. So this also needs to be addressed appropriately because placements of adjective in sentences means that shows a good grammar connection, good structure. Okay, so they typically appear in two positions. You cannot use it randomly anywhere. Okay, either before the noun or after the linking verb. For example, the hospital adopted a new protocol. Okay, and after the linking verb, the results were unexpected. And remember, there are some common linking verbs that we use like is, are, was, seems, appears, becomes. Okay, the patient seems stable. So these are the linking verbs. So sometimes after the linking words and sometimes before the nouns. Now it's time for us to practice. Let's apply whatever we have learned and try to answer the questions. Take your notepad, pen and paper, read the question and then try to answer it. So let's reflect. For the first one, the researcher presented a detailed analysis of the data. So what is the adjective here? Detailed, right? It describes the type of the analysis. And here the hospital introduced a new diagnostic system. The adjective is new because it describes the diagnostic system. Several experienced nurses supervised the training session. What is the adjective? Experienced because it describes the nurse, right? The patient reported intense back pain. Of course, intense because it describes the pain. The laboratory detected abnormal hormone levels. So here, which one? Abnormal, right? Because it describes the hormone levels. The doctor recommended a balanced diet, and which is the adjective here? Balanced, because it describes the diet. The study examined multiple treatment methods. So here, multiple is the adjective. The committee proposed a comprehensive healthcare policy. Of course, comprehensive. It describes how the healthcare policy is. It is very comprehensive. So, comprehensive is the adjective. The patient showed rapid recovery after surgery. What type of recovery? Rapid. The surgeon used a specialized instrument. So, we are describing the instrument as a specialized kind. So specialized is the adjective. Got it? So adjectives are far more than simple descriptive words. They allow us to communicate precise information. They describe complex issues. They improve clarity in professional communication. especially in fields as medicine, research, law, academia. The correct use of adjectives ensures that information is accurate and meaningful. That's all for today's video. Kindly like, share, and subscribe for more English tips. See you in the next video. Bye bye.